Gauteng Department of Health confirms that a group of 60 German tourists are currently under quarantine after one of them was confirmed with having COVID-19. For more on this, I'm joined on the line by Bandile Masuku. He's the Gauteng Health MEC. Thank you very much, sir, for joining us. Can you give us an update on what is happening with those 60 German tourists?
We're talking about 16, not 60.
Okay, 16. Thank you very much,
yes.
sir. Okay.
Yeah, because the issue here is that we're confirming that they are under quarantine. We had a bit of a problem with them being uncooperative. The issue could have been just also the issue of the language barrier.
Yes.
But we were able to get their cooperation at a later stage, so they are all under quarantine. And one of them is in one of our facilities in the hospital because he's the one who has tested actual positive.
Right. So then now, in terms of course, Germany is not one of the European countries that's on the banned list. Is that right? And that's why they were able to still come into the country today?
No, they were not. They came to the country last week.
Okay.
And they did the test, not last week, the week before the 15th. And they did the test on entry. And when they were about to leave, the Port Health had received their results. And because they were exposed as a group and also where they were staying, we had to then quarantine them and then start the process of tracing all their contacts and also making sure that the ones that have been on an immediate vicinity with the person testing positive, also to quarantine and also to be assessed and checked for that.
So where they're being quarantined, I do recall the president indicated that any foreign nationals who come here and they're found to be suspicious in terms of COVID-19, they would be quarantined in a hotel. Is that the case for these tourists?
We can confirm that they're in a facility that is conducive on the west of Johannesburg, which also was arranged in conjunction with the embassy. The German embassy.
Right. So where to next? I mean, in terms of what will happen to them next going forward?
I think we'll have to get through the lockdown finally, and then after that we'll then take them out maybe to allow them to go back to the country. But this is a discussion that we are engaging on it through DECO to make sure that we are able to keep and have a friendly relation with our counterparts in Germany.
Yeah. Dr. Masuku, the situation is very fluid. The numbers are going up quite rapidly. And of course, Gauteng has the biggest burden in terms of COVID-19 cases. Are you confident that in terms of our medical facilities, we're going to cope as more and more people become sick with this thing?
We are continuously escalating our capacity. Getting ready for when the wave will come, because I think we have to also be realistic that the wave will come, and we just need to be able to be ready for that wave. And at the current moment, we are confident with the numbers and the situation and circumstances of the patients that we have. I think we've been on the lucky side that most of the patients who have been found to be COVID positive have not required any hospitalization in ICU in our province.
Yeah. What are your observations around recovery? We don't hear much about recoveries. How long does it take for people to recover, assuming that's their destination?
You know, it's an issue that the minister will address this afternoon, because we also have to understand who do we say has recovered. You know, in theory and in science that we are following, it says that when you are recovered, it means you should have actually tested actually negative at least 3 times or twice or 3 times after you have been found to be positive before. And we know that the virus gets shed off your body or off the system in 14 days, meaning that your antibodies and your immune system could have mounted a proper response to deal with the virus. So the issue of the definition of recovery is a matter that we need as a country to understand, and also using International World Health Organization definition. Because the other point is that when people don't have symptoms, you know, and they don't have symptoms, the issue is that they are also at a lower risk of transmitting. And can we then consider those has been recovered.
Dr. Masuku, one last thing. Our colleagues around the country, our reporters are reporting around the country, in some instances where people are queuing for shopping, the social distancing rules are not being observed and so on. Particularly here in Gauteng, we saw in Alexander Township, for example, that it's business as usual and there's very little police or army presence and so on. How concerned are you about this, and what will the Gauteng government do to get on top of situations like that?
We have activated the MEC of Public Safety and the Premier through the police. We have closed down the Alexander shopping center at the current moment because we are quite worried with the movement that is happening. Remember, the lockdown is also supposed to limit the movement between our areas and between people. And now with the shopping and the food issue, it's becoming a big problem and a big issue for concern, which we will address as a provincial command when we meet this evening.
Thank you very much, Dr. Masuku. He is the Gauteng MEC for Health.